Silicon Valley is really known for its Facebooks, its Googles, its Twitters, and Zynga, and all that jazz. You know, everything that has to do with the internet and social networking, and you're involved in health.
Yes.
And you're one of the best healthcare investors here in Silicon Valley. How is
It's like being
it?
the tallest pygmy.
Well, how is it that you've been able to stay that way, to stay so laser focused?
It's just the tallest pygmy.
Right.
That's all it is. And how is it I've managed to stay so laser focused? I think there's lots of people in the world who would argue with the laser focused moniker. I consider myself to invest reasonably broadly and reasonably opportunistically within healthcare. I'm quite interested in the learnings that people have had with regards to the power of social networking to influence individuals' behavior and how one might apply those tools to modifications of patient behavior, whether it's adherence to drugs, so taking all of your medications, or losing weight, or taking care of your chronic disease. So there are lots of people in the United States who have diabetes or who have, chronic heart disease, where if they took some very simple steps every day, they'd be much healthier. And yet, for years, it's been shown that it's really hard to get people to do that sort of stuff. And so it's interesting to me whether or not one can take some of the learnings from Farmville or Facebook or Twitter and actually apply those base learnings to the healthcare industry in order to improve the health of people in the United States.
Healthcare is just incredibly risky. Do you think it's any riskier than social networking and investing in internet companies?
I thought you were going to ask whether it's any riskier than making films or opening restaurants, right? Or maybe running an airline, which are sort of the world's worst industries. I think the place that it is riskier is that it takes more capital to find out whether something's going to work or not. So the nice thing today about the internet is that you can iterate on product and iterate on business model on reasonably small amounts of money. And so even if things don't work, you know reasonably quickly, and you know for small amounts of money. The problem with healthcare broadly, whether it's biotechnology or medical devices, is that it takes you a lot of money and a lot of time to get to that critical experiment whereby something succeeds or fails.
Are you seeing increasing competition in the healthcare space in terms of investors?
Absolutely seeing increasing competition in the healthcare IT space. I think it's a confluence of multiple things. One, you've got Athena Health out there as sort of a beacon of success. So anytime a company goes public north of $1 billion valuation, people say, wow, you can make money there. And that's not only venture capitalists, but entrepreneurs say that. So you've got a flood of entrepreneurs coming into the space who say, gee, maybe I'd like to do something good for the world and, and improve healthcare, but also there's a way to make money. And that sort of compilation of mission and profit is a powerful attractant. And you have all of the policy changes and reform going on in Washington that sort of stirs the pot and increases the ambiguity and increases the opportunity for new businesses. And so you sort of mix all of those things together and you have a much more fertile environment for startups in healthcare IT than you have for the last 10 years or so.